My name is Karen Kurt, and I am going to talk to you today about robotic pyloplasty. I'm a firm believer that you can find almost anything on YouTube. And when I learned I needed to have a robotic pyloplasty, I went to YouTube and found a lot of medical center things and technical diagrams and stuff, which was helpful. And it talked about recovery time and stuff, but nobody was on there that actually had one that was talking about it. So I had mine 5 days ago, and I feel pretty good. Just a brief history, I had no idea that I had UPJ obstruction, ureter pyloric junction obstruction. They found it on a CAT scan, and it was agreed upon that I needed to have this surgery. I had a stent put in to hold me over, which was okay for a few months. Then they took the stent out, and I waited 2 weeks before my surgery so that the tissue could heal and be strong enough to have the surgery. It was a concern at that time that I might need a nephrostomy tube, which I Googled, and there is a girl who has a video on that. It's really good. Made me feel a little more comfortable that if I did need that, it would be, doable. But I fortunately did not. So I went into the hospital 5 days ago to have my procedure. Everything went as they told me that it would. I checked into the hospital. Of course, these COVID times, I actually got dropped off at the hospital, went in and got myself registered and settled. They took me in to put my IV in. I had a little trouble with because I had to do a bowel prep and everything, so I was kind of a little dehydrated, I think. So hard to get a vein, but once they got the vein, got me into the operating room. It's kind of a really cold environment. The table was very narrow and I guess what you would want in an operating room, a very sterile environment. And that's all I could remember until I woke up in the recovery room. I guess the procedure took about 2 hours or so. And when I woke up, I wasn't in too much pain. They were doing a good job managing my pain. I had a Jackson Pratt drain on my left side that was draining a little bit of blood, and I had a urinary catheter for the urine, and I have about 5 little incisions. The biggest one is at the belly button. Apparently, I think maybe that's where they put the robotic camera to go in, but I have one above my belly button, the JP drain on my left, then another one lower than that, then one right above my pubic bone, a few dressings all around, and some abdominal pain that they were treating with IV pain medications. I had to stay in the recovery room for a long time because of COVID. They did not have a bed for me. So I was there for actually 10 hours, which wasn't so bad because they had this fabulous blanket that blew warm air at you and you felt like you were kind of in a hot air balloon. And got a lot of good attention because there in the recovery room is pretty open space. So if I needed anything, somebody was there right away. I finally got up to the room and was able to rest for the night. In the morning, they were able to remove the urinary catheter and put me on oral pain medications. I had been NPO prior to my surgery. Then I was allowed ice chips and stuff in the recovery room. And then when I got to my room, I was able to have a few things to eat. I wasn't very hungry. I was really leaning towards just soft things like pudding or, didn't really want to eat much, but a little bit. And I felt pretty good. Moving around was a little tough. My abdomen felt really tight and lumpy. Then they told me that I was going to go home that day. I'm not sure if they would have kept me more than one night if it weren't so dire, the situation with COVID and needing beds. But in the afternoon, they discharged me. The surgeon's assistant came and took out the JP drain, and I got my instructions and went home. I felt like maybe it was a little too soon because I was uncomfortable, quite a bit uncomfortable, and very tired. But I got home, my son drove me home, and the first 2 days were moving very slow, pretty uncomfortable. But I'm day 5 now, and I feel good. I get tired, but the incisions look great. I don't have a lot of pain, just tired, just trying to take it easy. They told me I'm not to lift anything, and I'm not to do any real exercise other than walking. I did walk 2 miles yesterday. I think it maybe was too far. Today I'm pretty tired, but overall it was pretty easy, and I feel good. I'm to go back to the doctor 2 weeks post-op, and then again 6 weeks post-op, because they do put a stent in for the healing, so they'll need to take that out. And then the doctor tells me that I'll have to follow up with a scan to make sure that the hydronephrosis is gone and that the kidney is functioning. And they'll do that, I guess, maybe annually. So that's what it's like to have a robotic pyeloplasty. If you're having one, good luck to you. Make sure you rest and take it easy. Thanks.